You just don't know what's around the corner, and having a healthcare system that is robust and prepared for whatever might be out there. Maybe it would be an asteroid strike next, I don't know, but there's a strong argument for it.
Hello and welcome to Idioms of Normality. I'm your host, Paul Mason, and this is part of the collective podcast series of Future Framed TV on Traces&Dreams. And I'm joined today by Dr. James Trauer, Associate Professor James Trauer from the School of Public Health at the University of Monash in Melbourne. And he's been a very difficult person to catch because for the last couple of years, he's been very busy working in infectious disease modelling and also as a respiratory physician. So you can imagine how hard it has been for me to get some of James's time. And thank you so much for joining us.
Thanks, Paul. It's a pleasure to be here.
So let me jump in with the first question. What is normal?
Yeah, I feel like I thought I knew this a couple of years ago, and the pandemic has turned things upside down, at least for me, and I think for a lot of us. I mean, I remember doing my public health, so I'm also a public health physician and a respiratory physician, and I feel like as we were studying principles of public health medicine, that we sort of had a framework and we knew where we could work. We knew sort of what population interventions would be accepted by people, and then the pandemic came along and things changed so dramatically, and I guess things that I sort of previously thought might be normal, just like delivering a vaccination program, had to be totally reframed.
In not coming to expect something like mandated vaccines, do you think we've become accustomed to a certain kind of normal which perhaps is worthy of questioning?
So like prior to the pandemic, whether we sort of like lulled ourselves into a false sense of security that these things weren't needed, or yeah, you're probably right. Because I guess there are a lot of vaccines that we do essentially mandate, and we have got, in fact, in Australia, like policies for mandating vaccination for children, for example. And that's sort of, well, it's not universally accepted, but for certain infectious diseases, we do consider that to, I guess, on some level be normal. And actually, so I probably should have qualified my earlier comments in saying they're more sort of about adult vaccination, and vaccinating adults is much harder than vaccinating children, or sort of compelling adults to be vaccinated.
One of the discussions I found interesting around the vaccines against COVID-19 is that some people push back and say, it's not even a fully effective vaccine. And I've had some really interesting conversations with people saying, well, actually, one of the most widely delivered vaccines in most countries around the world is only a partially effective vaccine, which is, of course, the BCG vaccine. The BCG vaccine has been around for almost 100 years. It's partially effective against tuberculosis. I think it's more effective against leprosy, and it seems to have this wide spectrum of efficacy against a whole range of diseases, making it quite a useful vaccine to deliver. But we're so accustomed to the idea of giving vaccines, and we have this idea in our heads that they are 100% bulletproof, and if you are vaccinated, you will not get sick. And yet the COVID-19 vaccine really started the conversation of, well, not all vaccines are actually 100% effective. And people were sort of going, well, if I'm vaccinated, then why should I worry about having to wear a mask? Or, if I'm vaccinated, why should I worry about someone else not wearing a mask? How have these conversations, because our normal has been to just assume that we're safe, right? When is assuming that we're safe really, is that an illusion, or is that something that we genuinely had?
I guess these sorts of issues do really dig into why are we saying that people have to be vaccinated for these particular things, and as a public doctor, you have a real responsibility to articulate that, and I think, coming from a background in BCG, I have, I guess, done a reasonable amount of research on BCG, and my group undertook a sort of a review of the evidence around it. And BCG, because it's a neonatal vaccine, I think, the younger people are, the more compliant they seem to be with vaccination, and children who are aged less than a month tend to be pretty compliant with vaccination. So it doesn't seem to have been a huge global issue. But then we see real parallels, I think, with the COVID vaccine, because when that first came along, it was incredible how effective it was. I mean, nobody really expected to have a vaccine that was that effective. When the first studies, I guess, just at the very end of 2020 or the start of 2021 began to come out that we might be seeing something that was highly effective against COVID. But it was effective at reducing your risk of COVID, that's COVID disease, and the effectiveness against onward transmission was a little bit more difficult to understand. And then I guess a little way on from that, we had variants emerge, and there's less and less evidence that the vaccine protects against onward transmission with the variants. Like, to say that vaccinating large proportions of the population is going to reduce the transmission of Omicron is trickier. And we've also seen that we've now got a lot of population immunity, and we've got a lot of protection against hospitalization, and it's becoming less likely that we're going to see these huge spikes in transmission that are going to overwhelm our health service. So what is the rationale for mandating vaccination? And I mean, I'm not saying it's not there, but it's much harder, I think, for somebody in my position, or for somebody, not my position, somebody who's like thinking about whether we should mandate vaccination and why we should mandate it. It's harder to articulate that than what it was. I'm not saying it's not possible, but there's a lot of responsibility placed on public health doctors now, I think, to articulate the reasons.
One thing I found really interesting is how the responses in some low-income countries where they're protesting to say, come on, we want the vaccine. And then some people in high-income countries are doing the exact opposite. Yeah. It's mind-blowing how the sense of normality in both these settings is so completely divergent.
Yes, that's right. I mean, yeah. And I guess it's sort of ironic it is that the high-income countries are the ones that have got the vaccine, and the people protesting against having it, and then the low and middle income countries, they're probably desperate to get it and they haven't got as much of it. And I suppose it also relates to expectations. In high income countries, I think people expect to have access to good healthcare, and that includes effective vaccinations, and we do have an expectation of that sort of thing, high quality healthcare, and being able to be protected against these severe diseases. But with that, I think there's an expectation of choice as well, that people will be able to make, I guess it's with that people will be able to make their own choice about whether they get vaccinated. And every setting's different around the world. And I guess equally to lump all high income countries, or even all people in high income countries together is very difficult. And there are people at very different ends of the spectrum. For example, in Australia, you think of the people who are there are people who are extremely pro-vaccination. I mean, there's people who have been very, very anti-vaccination. There's things are so polarized that it's hard to see where normal is in the middle anymore. That you get a lot of this publicity around people who might, I guess, be anti-vaccination. And I think we're all very familiar with that, and the protests that you just mentioned are one manifestation of that. At the other end of the spectrum, you've really got a significant group of people who are really very scared of COVID, I think, and are desperate to get interventions that are maybe even a little bit beyond what they need, like, ensuring that 2 and 3-year-olds are vaccinated to protect them against severe outcomes. I mean, the evidence around things like that is much more tenuous, and whether you should restrict the socialization of your 2-year-old in order to prevent them from getting COVID. People probably go too far on that as well.
In your work and in the healthcare setting in Australia, and I don't want to extend the discussion too far, but in a country where we've been relatively comfortable in terms of protections from infectious disease, where we don't see the rates of problems that we see in some of our neighbouring countries. And also, we're in a political environment where since the 1980s, both major parties in Australia have slowly been making cutbacks to our healthcare system. And then suddenly, COVID-19 comes along. The system isn't able to just coast along the same way it's been coasting before, with, gentle cutbacks after cutback after cutback. And suddenly the only way to make sure the system isn't overloaded is by asking for people to basically go into lockdown for prolonged periods of time, because the system no longer has that robustness in terms of the economic flexibility that it may have had 20 or 30 years ago to respond to something like this at a very short notice. Do you think that that moving forward, we'll be able to establish a new is the system changing basically is the system changing in response to what's happening?
I mean, so like you say, it should be. I mean, there's absolutely no question about that. And if we don't change it now, when will we ever change it? I mean, this is a once in 100-year pandemic, probably. I mean, hopefully we don't get another one next year or anything, but we haven't had anything as bad as this or disruptive for society in that long. And having a much more robust healthcare system would have been considerable additional protection against all of these things. And I guess, one of the reasons why we sort of had no choice but to go into lockdown and to adopt this really stringent COVID zero elimination approach all the way through to when we were vaccinated, which I think that was the right response, particularly given the situation we were. Even in hindsight, I think it was what we needed to do. But one of the reasons for that is because we didn't have a health system that was robust enough that we could just let transmission go crazy. And I think I do have to qualify that by saying that if there are infectious diseases, or at least in theory, that could emerge into human populations that would just spread so rapidly that no amount of planning and no healthcare system could possibly protect you against what you were seeing. And I wouldn't like to see any healthcare system try to stand up to some of those like really rapid Delta epidemics that occurred, at the start of, throughout 2021 in some countries. But if we don't, we've got the most compelling argument we've ever had to renew our healthcare system at a national level, link it up, reduce this state-federal divide, refocus on patients and preventive healthcare and disadvantaged groups. And if we don't do it now, as we're heading into a federal election campaign, I think we're speaking about 8 days out from a new federal election. If we're not discussing it now, we will never be discussing it.
Yeah. Well, I've got to say, it's been great to see the Nursing and Midwives Association out there and advocating for greater carer to patient ratios, which is obviously desperately needed in so many different sectors of healthcare. And, most people are on the receiving end of healthcare. And for people within healthcare, it's been an incredibly taxing time, both professionally and personally, on doctors and nurses working in, what would otherwise be considered, globally, the Australian system would be considered quite a good system, but nonetheless, it has put an incredible amount of strain. Have there been some measures changing or being put into place in order to reduce that strain?
There have to some extent, but probably not enough. And I think a lot of healthcare workers don't feel as supported as they might, and very, very understandably. And there's probably, I feel like there's been a series of mistakes that have probably been made in our response along the line, and some of them have been very well publicized. And in fact, most of them have, I would say, in terms of that, in the first year of the pandemic, the lack of PPE for healthcare workers was a major issue. And it certainly felt like governments were deliberately, I think it felt to a lot of healthcare workers like governments were deliberately trying to avoid recognizing that COVID was airborne in order that they didn't have to provide PPE. And that was a major issue when that was all we had. And then we needed vaccines, and vaccines procurement was poor at the Commonwealth level, and that's very well publicized. And then after that, we had Omicron hit, and then rapid antigen tests were what we needed, and all of a sudden we didn't have them either. So I guess all the way through, the health services I think healthcare workers have felt unsupported. So that's more that we could have done in the short term to maybe improve things, to at least have higher morale for healthcare workers to feel that they were being supported, and aged care workers as well, and so many other groups. Yeah, we could have done more in the short term, and I think we need now to look to the long term. I mean, I'm in Victoria, and We've got a state election later in the year, and it is becoming a major state issue, and the government's announced a reinvestment in healthcare in Victoria. And these things don't seem to be as much on the agenda at the federal level, as much as there are some people talking about it. And it would be good to see more of it.
How can we question normality moving forward so that we can maintain robust healthcare systems?
Always expect the unexpected. SARS should have been a pretty good warning to us, and we weren't prepared for a coronavirus pandemic. And actually, we should have been prepared for a coronavirus pandemic, but we were more, if anything, we were sort of more expecting a flu pandemic, and the flu pandemics had become progressively milder, the pandemics that we've seen over the last century or so. And I think people just were lulled into a false sense of security, and nobody remembered, there's nobody alive today who remembers the 1919 flu pandemic. So, but it's not just pandemics. I mean, we should have a healthcare system that can be prepared for anything. I mean, like, who knew 10 years ago that Ukraine would be going through what it's going through now? And a well-prepared, well-resourced healthcare system in that country, for example, would be a useful thing to take into a crisis like that. As much as, I guess, well, as much as I'm not an expert on that area, you just don't know what's around the corner, and having a healthcare system that is robust and prepared for whatever might be out there. Maybe it would be an asteroid strike next, I don't know, but there's a strong argument for it.
I feel in what you're saying there that there's a degree of complacency in our sense of normality.
Yeah, I think it is complacency, and sort of maybe a human tendency to just, want to do what you're interested in and what's working at the moment. Yeah.
To keep doing what you're already doing without forethought. Sounds like a scary strategy, like but that's the scary thing for me about normality, isn't it? It's that we can become lulled into the comforts of normality, and we don't prepare for contingencies.
Yeah, exactly. That's right.
James, thank you so much for your time. It's been a pleasure chatting with you, and certainly a completely different perspective on normality, looking at normality from the perspective of people who have had to rapidly adjust to deliver services to entire populations that they previously haven't had to deliver and cater for. So thank you for all the work you're doing behind the scenes, and thank you for coming on the show today.
Thanks, Paul. My pleasure.